let's get into it. Got a bunch to cover. Welcome to 25 Minutes with Cap. Each month on this webinar, we discuss different topics in the specialty insurance space. And I'm excited today to have Jen Peone, the head of human services here at CapSpecialty. Jen started in the business in 2009. She's been at CapSpecialty for 7 years. She's been at different parts of the business, most recently running this specialty product for us. Jen, thanks for joining us.
Yeah, thank you.
So just a quick disclaimer note: the content of this webinar is property of CapSpecialty. It is for informational purposes only. You're not permitted to republish, share, or quote from this webinar without prior written consent of CapSpecialty, which could be obtained by contacting marketing@capspecialty.com. There's a chat function in the bottom. If you have any questions along the way, put them in there, and we'll try to get to them. If not, we'll reach out directly. Thank you. So first, Jen, what is human services?
Yeah, so human services for us encompasses 4 main units. So we look at substance use and mental health, which kind of fall under the behavioral health umbrella that we'll be talking about today. But we also look at youth organizations as well as intellectual and developmentally disabled organizations. And what's unique about human services is a lot of times those 4 will kind of coincide with one another and may even incorporate some of the same clientele. And what's even more unique about the behavioral health space specifically is that there are more exposures to things like abuse, which is one of the topics that we'll kind of touch on today.
So it's such a specialty area. There's the medical component, the GL component. How'd you get into this space?
Yeah, so CapSpecialty started a product with healthcare. It started as both miscellaneous medical and human services, and we saw that there was definitely a need for more human service writers. The space was kind of growing. There was a lot of admitted carriers in the space, but there was definitely a need for a non-admitted product as the market started to change and the conditions were starting to harden and created an opportunity.
As an underwriter, how did you get into the space? Do you go to school for this, or?
No, it was something that I specialized in back when I was with an admitted carrier, and I really focused in on it as an area of interest because it is so unique. The exposures are very expansive. There's a lot of different aspects of an organization that you have to understand in order to underwrite it properly. So I found it to be really interesting and it was a great opportunity since there was definitely a need for it.
So, you talked a little bit about the broad expanse of kind of what fits into human services. And the last thing you talked about was abuse. And you certainly hear people talk about abuse when they talk about social inflation, generally rising claim values. Can you really underwrite it?
So there's definitely no silver bullet to underwriting abuse. There's only 10% of abusers actually encounter the criminal justice system. So the use of background checks is certainly not a comprehensive tool to use, although it is definitely necessary. When you're talking about behavioral health, you have a susceptible client population. They're going to these organizations with a need for assistance. And then you're also trying to form relationships with a professional so that they can help you. So that alone will create the opportunity for abuse situations to occur. There are different factors that we kind of take into consideration when we're looking at individual organizations. One is the actual building design physically that they have. So is there an opportunity for abuse to occur physically in the centers?
Well, so hold on. So what does that mean? So if you call it a youth facility, what types of things are you looking for there to be, or what do you view as to be a real concern?
Yeah, so we can look at things like whether there's individual rooms for each individual youth. So is there enough space physically for each individual youth to have their own room where the common spaces are being monitored by cameras? So it kind of lessens the exposure because there's less opportunity for it to occur. And in some outpatient settings, we're seeing more windows in one-on-one spaces. So although there's a need for one-on-one conversations to happen with a youth and a professional, is there an open space for someone to walk by and potentially see something happening?
Right. So, okay, so I stopped you in the middle of that. So you look at the physical footprint of the building. What are some of the other things that you're looking at?
Yeah, then one of the other biggest factors is staff to client ratios. So obviously, if there's more staff in the building, then there's less opportunity for an individual staff member or a client to actually perpetrate. And then what kind of risk management is involved? Do they have trainings to help professionals identify both the opportunity for it to occur or an actual occurrence of it?
So, that sounds good. However, what you find, and I think you're finding in all different parts of the healthcare space and in many other industries, you have problems with not enough people going to work. People are too low paid, especially when you're dealing with some of the nonprofits that you're working with, small budgets, and a very stressful business that lends itself to high turnover. How do you navigate all of those things?
Yeah, and well, first we have to deal with it with terms and pricing, and also limit and venue management.
Sure.
So we understand as underwriters that we're not going to 100% be able to predict whether an abuse will occur in an organization.
Sure.
So we use different tools and the flexibility of our products to try to make it so that we are able to underwrite it profitably, with the understanding that it will occur, unfortunately. But one of the biggest things is really understanding the culture. We use a tool, we use risk calls as a tool to try to help do that. So what does the management say about the organization? What kind of, what passion comes across in the calls that they're providing us with? We can also look at factors on the supplemental application. Turnover percentage is a really great tool that we can use because it really speaks to some of the financial implications that can occur when there's high turnover, and it can also provide lessened continuity of care for individual patients, and can a lot of mistakes can happen when there is a high turnover percentage at an organization.
So you talked about culture and passion coming across. Do you see it where that doesn't happen, where you're on the risk call and it's not going the way that you feel like it should go?
Yeah, certainly. We've been on calls where we really don't get a good feeling from the executive. They are not coming across as making it seem like this is an important piece of the organization, which it certainly is. Insurance is definitely an important piece of what they do, and making it seem like we're not a partner of theirs and more of just an adversarial type relationship. So we've definitely been on risk calls and said no to clients as a result of the findings that we've had.
One of the things that I know we've talked about, and you see it with different carriers, is risk management. And I guess, what type of risk management is out there, one, but does it even help? Or are you finding that it's actually hindering it, where people are kind of teaching to the test and maybe not getting all the way there in terms of the culture that you'd like them to have?
Yeah, I think that there's a spectrum of risk management services that are out there. There's definitely a canned risk management service where it's more of just a checkbox and a checklist that people go through to make themselves feel better that they've asked the question. We don't subscribe to that. we subscribe to more of an a la carte type process, working with Omnisure to discuss what the challenges are that the individual organizations are seeing and where we can feel like we've actually made a difference and can make an impact on the organization. So things that we've done with organizations include assisting in growth into new services that they are looking into, working through a new regulation that impacts their organization, and then working through emergency situations that come up on a daily basis.
The when you kind of look forward and see the challenges that some of these businesses have had, what are kind of your predictions? I guess first for how you're thinking about underwriting the abuse business, and then let's talk about some of the other business. But how do you see risk evaluation with abuse changing, or is it going to change?
I really don't see it changing much other than the market factors changing the way that we underwrite and price for it. The organizations that we see are a lot of times not for profit. They're never going to see huge increases in wages as a result of that. They're always going to be strained because there's always a need for human service organizations to provide more and more services to more and more people, which we're seeing a lot of because of COVID. The increased diagnosis of mental health issues and the increased need for it is putting a strain on the environment. So I don't really see that changing. Some trends that we will kind of look for is the trends in professionals entering into the space. Some of the conversations that we've had with insureds have talked about the development of new professionals and recruitment of new professionals to try to lessen the blow of some of the turnover that they're seeing. So that will be a really great development. But with the market changing so much, the increased social inflation costs, the cost of just claims generally, these nuclear verdicts that are changing the minds of juries, all of those are impacting the way that the premiums are being impacted. So we'll have to adjust for that. And one thing that I'm kind of hopeful for is that it'll renew the conversation of caps on non-economic damages. We've seen it a little bit in some states. Tennessee most recently put new legislation in place to cap non-economic damages. So I'm hoping that it kind of spreads throughout the country and becomes a renewed conversation, because it's definitely necessary.
You've talked a little bit about how telehealth is seeping into many of the other areas of behavioral health. I guess talk some about it for the viewers, and how do you feel like it's changing the business for the better or worse?
I think that it's kind of still yet to be seen. There are definitely different challenges when it comes to telehealth. One specifically is the patient confidentiality aspect of it. And I know that there's a lot of question right now of if there was patient data leaked, what kind of coverage would that implicate, whether that would be cyber or a professional liability policy. So there's definitely a lot left to see as it grows as an industry and more people subscribe to it. But I think that overall it will help, because there'll be more accessibility to clients that are needing this service, both from a location standpoint. Patients that may not have had access to a provider previously now do, and people that aren't able to get into a physical office because of just time constraints will now be able to. So I think overall it will have a benefit on society and hopefully will help the environment in the mental health space, but it certainly will come with its challenges.
So much of your business is about people doing in-person treatment or living at a facility. You talked a little bit about people maybe doing sessions remotely, but do you see potentially a change for people moving from residential to remote?
I don't. I think that the people that do need inpatient treatment are going to seek that out. And we already see people moving to facilities, even if it's not within their immediate community, to seek out that treatment. So I don't see that changing. I think that there is still a need for inpatient and a higher level of care.
Okay, another kind of hot topic that's been discussed is use of psychedelics within treatment. What's I think some people might be surprised by that. What's kind of the range of use, and is this not only insurable but actually best practice in some cases?
Yeah, so we are seeing it pop up fairly often now, as states start to change the way that they think about it.
And where
The FDA,
sorry, and where do you see it? In which particular types of treatment or which type of patients?
so for the most part, we're seeing it on the mental health side.
Right.
It's being used in chronically depressed individuals. We're seeing it with use of eating disorders. So there is a range of disorders that can be treated through psychedelics, and the FDA has approved the use of them in certain aspects for treatment. With anything, there will be organizations that use it kind of to their advantage and may not follow the mainline FDA approved way of prescribing it. One way that we saw it was that there was guided trips on in the Burning Man, and some of those I would say are probably uninsurable. I don't know that anyone would say, sign me up for a guided trip throughout the Burning Man music festival. But in a very
but maybe not one of the patients.
But in a very controlled way, it has been shown to be very effective. So I think that we will start seeing more of it. I just saw actually this morning that Oregon is going to be adding some facilities throughout the state that will be using psilocybin in these facilities to create more of an environment that's safer to use it in.
Right.
So I think we will start seeing more of it as it becomes more popular.
Right. One of the things I was curious about, and we've talked a little bit about it off and on, is you talked a little bit about the risk calls that you do, and when you're doing risk calls, you need to be pretty close to the client. How you're also wholesale only. How do you navigate that?
Yeah, so we have developed a really trusting relationship with our wholesale brokers. We've been wholesale only from the beginning. When we started this, we did a lot of education of our brokers to talk to them about what types of risks they will be seeing, what types of exposures we have to work through, what a good submission is so that we can understand fully what the organization is doing and what we'll need to review in order to quote it effectively. So the trust there is definitely key and has allowed us to create relationships with both retailers and insureds, and which has really been fundamental to our underwriting strategy.
Awesome. Hey, so one of the questions that came through here, what umbrella limits are available, and do you follow form over all underlying limits, and what are abuse and molestation limits that are available?
So we do write excess follow form. We will write a maximum of 5 million in our excess, but we are very strategic in when we deploy those. You will more commonly see us write 1 million and 2 million excess limits. On the abuse side, we will write 1 million in the primary and then up to 2 million in our excess. But our excess deployment will really be around a function of where they are from a venue perspective, what types of clients they're seeing, and what their history and size are.
Great. Jen, did I miss anything in terms of, as you look toward the future of other behavioral health, trends and patterns? Anything new that you're forecasting?
And I saw another question had come up, so I'll just kind of work that in.
Yeah, sure.
So we definitely are seeing, as the market has hardened, that pricing has come up. It is a harder market. We're seeing it more so in human services than we have in other parts of the organization, which
Sure.
is needed. We did struggle for a little bit in the number and volume and the amount of claims that were coming in. So we needed to take rate in order to get to a place that we were more comfortable with. So pricing across the board has definitely come up, and we are definitely in a hard market when it comes to human services. We're seeing a lot of restriction on capacity from our competitors, and we're seeing a lot of use of exclusions and sublimits to try to write the business at a price that the insured is able to afford.
Right. Understood. Okay, great. Well, hey, Jen, really appreciate the time. Thank you all for joining. And you'll be seeing, we'll have next month, we're going to have the cat modeler, Karen Clark, as our guest. So stay tuned for that. Thank you all very much. Thanks, Jen.
Thank you.